What's up everyone? Today I want to talk about sciatica. Now sciatica affects thousands and thousands of people every single day, and we get tons of cases in our office that we need to help people with that type of issue. Now I want to go over what sciatica is, how people tend to get it, but more importantly what you can do about it. Now, I had one patient come into our office the other day. She came crawling in, humbling in, and what happened was I asked her, I was like, what's going on? She's like, Doc, my sciatic nerve is killing me. And I'm like, you mean your sciatic nerve? She's like, no, my sciatic nerve, it is just driving me insane. And I kind of laughed, she laughed, but really sciatica affects so many people, not just physically, but also mentally, and that might be affecting you as well. So let's talk about what sciatica actually is. In your spine, you have these nerves that come out of it, and it goes from your brain down the spinal cord, out these nerves. In the lower back, you have L4, L5, and then some of the sacral nerves that go into this bundle, and it's called the sciatic nerve. This travels down into the back of your thigh, down into your legs, and into your feet. Now what happens is there's three major reasons why you might get that nerve aggravated. The first being you might get a disc herniation or disc bulge. Sometimes what happens is those bones can shift out of position, and when that happens, that puts stress or strain onto the joint, leading to a disc bulge or disc herniation. That will inflame that nerve and cause that pain that you're experiencing. The second reason you might be experiencing that pain is because that pelvis can shift out of position. When that shifts out of position, that's going to cause strain onto that joint, irritating that nerve as well. The third reason is what we call piriformis syndrome. That's that muscle that goes from the sacrum or your tailbone, and it shifts right across to the hip, and it's going to cause pressure onto that nerve. If that muscle gets tight, it gets spazzed, it gets irritated, it's going to strain that muscle, and it's going to cause that inflammation and irritation to that nerve. Now, what true sciatica is, it's basically where you get pain, radiating pain shooting down into the leg, numbness, tingling, burning sensations. That's what true sciatica is. So sometimes patients come in and say, Doc, I have hip pain, I have glute pain. That's not true sciatica. True sciatica is actually where you get pain irritating from the back down into the leg, down into your feet. That's what sciatica actually is. Now, what's the solution to it? The main question is, what do I need to do to fix it? Now, in our office, we give specific stretches and exercises, and I want to go through that and show you exactly what those are right now. So the first thing I always tell people is you want to start with back extensions. Now, the first and easiest back extensions, especially if people have severe sciatica, is just going through at the edge of your chair. And you want to sit on a firm surface, not one of those couches or anything like that. You want like a kitchen chair, a dining chair, or a very firm stool or something like that. And you're going to sit at the edge of that chair, edge of your seat. You're going to sit with your feet shoulder width apart, your hands on your knees, and you're going to go ahead and go into a back extension. The reason we're going to go into a back extension is because you're getting that disc bulge, that disc herniation, and you're trying to push that disc towards the front of the spine and away from the nerves to take off the pressure or irritation onto that nerve. And so the way you do this, you're going to go ahead and just push your belly forward, and you're going to rock your pelvis forward. As you do that, you're going to bring your chest up to the ceiling and looking up to the ceiling as well as high as you can. Now, when you do that, you're going to rock forward, looking up to the ceiling, and that's going to put you into a really deep back extension, and then you're going to return back to neutral. In an ideal situation, you don't want to go into flexion just because that's going to push the disc towards the nerve and again, irritating that nerve. What you want to do is just keep yourself into extension, holding that for a couple of seconds, and then going back to neutral. Again, going into extension, lifting up to the chest, to the ceiling, and then going back to neutral. You want to do this for about 5 to 10 times, and then you can do that for roughly about 2 to 3 times a day. And again, going back up, and then going back into neutral. Now, the second back extension that we want to give people is what's called the cobra stretch. That's where you're laying either on the floor or on the mat. You could potentially do this on a mattress as well. But what you're going to do is you're going to lay on your stomach. You're going to go ahead and place your elbows into the floor. When you do that, you're going to arch up and go into that back extension and hold that for a brief couple of seconds, and then go back into your belly onto the floor. Again, lifting that back up, holding that for a couple of seconds, and then going back down. You want to do that for about 5 to 10 times. And then relaxing that. Once you feel like you can tolerate that with your elbows, then you can go onto your hands, and then you're going to deepen the stretch by going all the way up as high as you're able to, and then you go back down. You want to work to the point where you can actually really deepen that stretch by straightening up your elbows and holding that for a couple of seconds, and then go back down. Now, what's really important is that you should not cause yourself excruciating pain. You can feel a little bit of discomfort, but then right when you feel that discomfort, ease back down and go back down to the floor. Now, It's important for you to note that if you're having any aggravation or it's causing the symptom to become worse, you want to take a step back and only go to the point of discomfort and then go back down to the floor. You don't want to push yourself to the point of pain. Just discomfort, that's okay, not any pain. So that's the second exercise that we want to get. The other exercise that we want to do is what's called pelvic range of motion. What that looks like, again, because your pelvis gets shifted out of position, that can get stuck like that. We want pelvic range of motion, which is where we basically want that joint to start moving. And the idea is that you want to work that misalignment or that fixation out. And the way you do that is either one, by getting some walking in. You want to go for about a walk for 10, 15, 20 minutes, up to 30 minutes if you're able to. A lot of patients that have sciatica will find that walking really helps to alleviate some of that pain. The second exercise that you do to get pelvic range of motion is what's called a cat-camel stretch. Again, this is where you're going to go onto a floor or onto a table. I don't recommend doing it on a mattress just because that can be pretty soft and that's going to cause you to have some instability. But you want a firm surface with your knees shoulder width apart, your hands shoulder width apart. You want to go down with your belly to the floor, arching and pushing your pelvis down towards the floor. So you want a big arch into your belly, getting into that back extension. And again, you want to go more into a neutral position. If the sciatica is not that terrible, you can go into a flexion, but the idea is that you want to try to stay within neutral or into a deep stretched belly down into the floor. Now what you want to do is you want to do this for about 7 to 8 cycles, looking up to the ceiling and then coming back to neutral, going up to the ceiling, belly to the floor, and then back to neutral. So you're kind of killing two birds with one stone with this. You're actually getting a deep back extension and you're also getting pelvic range of motion within this as well. So again, you want to do that to around 7 to 8 cycles. Again, you can do that 2 to 3 times a day. Now, the third thing that we want to do is what's called a piriformis stretch. Again, this is where that muscle goes from the tailbone, it reaches across to the leg, and it's going to get tight, it's going to get shortened, it's going to get spasmed. We want to start to loosen up that muscle. Now, the way that I find that's best to do this is what's called the figure 4 stretch. You want to get to the edge of your chair, feet flat on the floor with one foot. So if this is the affected side, you're going to straighten the opposite foot all the way out because that's going to allow you to put this foot over your knee. So bringing that foot over to the knee, once that happens, you can now bring that foot back towards the table. And as you bring that foot up, now you're going to really start to feel that stretch into the glute. Now, as you do this, what you don't want to do is arch from the back. You want to arch from your hip. And so what you're going to do is you're going to keep your back nice and straight, keeping your chest high, bringing your sternum down into the leg. As you do that, you're going to reach forward, keeping that back straight. You're going to again pivot from the hip joint. And as you go as far as you're able to, what you're going to want to do is hold this for about 30 seconds. They've done studies that show if you don't hold this stretch for at least 30 seconds, the stretch is pretty much pointless. You want to hold this thing for about 30 seconds. As you get to that point where you're kind of getting stuck here and you kind of already feel that stretch, you can deepen the stretch by taking a deep breath. And when you exhale, you're going to let your body go as far down to the leg as possible and holding that for a brief couple of seconds. Deep breath. And as you exhale, just try to really deepen that stretch as far down as you can. Now, again, you can do this with both legs. I recommend that because it's a really good stretch in general, but especially if you have sciatica being caused by that piriformis syndrome, that's going to irritate that nerve. We want to start loosening that muscle, and that's going to help to alleviate that stress that you're having. Now, one thing to keep in mind, when you do stretch that muscle, you might possibly be stretching the nerve as well. When you're pulling that nerve, it's already inflamed. That can cause a little bit of a triggering of the sciatica. If you feel like the pain is increasing or it's really bad, take a break, ease off some of that pressure, do some of the other stretches that we talked about before. But if you can handle this and actually bear with some of the discomfort, that's going to be really great. But again, discomfort's okay, but not pain. We don't want to go into pain. Okay, so the other thing I want to do is the piriformis stretch in a lying position. Now, some people, they can't do that where they're seated. So when you do the lying position, you lay on your back with your foot, both feet onto the floor with your knees slightly bent. You're going to bring one foot over to the knee. And as you bring that, you're going to slowly bring that leg up. And with both hands, grab the back of the leg. And you're going to bring that as far back as you can towards your belly, towards your chest. Now, again, you can hold this for about 30 seconds. And if you really want to deepen that stretch, hold on to the ankle, bring up the hand over to the knee, and then you're going to really push that towards your chest here. Now again, taking a deep breath, exhale, and again, you're really pivoting at this hip, bringing that knee down towards the chest. So if you have trouble doing this while you're seated, the alternative would be greatly is if you can actually lay it on your back and you're going to bring that knee towards your chest just like that. Okay? All right. So those are the stretches and the exercises that we give to our patients. Now, one of the biggest things I will tell you is going to see a professional can help you greatly. Really, one of the biggest things I tell people is seeing a chiropractor that is specifically trained to identify which actual problem is coming from, whether it be from your spine, from your pelvis, or that piriformis muscle. Now, one of the things that we can do is we can identify where that level of inflammation is coming from. Once we find out where that inflammation is occurring, leading to inflammation onto that nerve, irritation to that nerve, then we can start going about correcting that, whether it be a structural correction with the spine, structural correction of the pelvis, or doing some work onto the piriformis muscle. We might want to ease up some of that pressure as well. That's how we find the greatest relief for our patients, and I hope that's something that you can benefit from as well. So that's pretty much it. Thank you so much for watching. If you like this video, please click that like button. Click the subscribe channel just to see more videos just like this. But thank you so much for watching. We appreciate you. God bless. Have a good day. Peace.